Welcome to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Our focus is the novel coronavirus. I'm Josh Sharfstein, a faculty member at Johns Hopkins and also a former secretary of Maryland's Health Department. Our goal with this podcast is to bring evidence and experts to help you understand today's news about the novel coronavirus and what it means for tomorrow. If you have questions, you can email them to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Professor Sara Bennett speaks to Dr. Kumanan Rajanathan, Health Systems Coordinator for the World Health Organization in Cambodia, a country that has seen relatively few COVID-19 cases to date. They speak about Cambodia's response and how previous investments in health security after other outbreaks continue to help keep people safe. Let's listen.
Dr. Rajanathan, thank you so much for joining me today.
Hello, Sarah. It's a pleasure to be here on the podcast.
When I look at the first 4 months of the outbreak in Cambodia from sort of late January through till the end of May, it seems like the country's done a really remarkable job in controlling COVID-19. What do you think were the most important measures in terms of containing the epidemic?
Certainly, when we look at the global experience, the first 4 months in Cambodia, from the detection of the first case on the 27th of January through to the end of May, went well. There were 125 cases, and there were no health worker infections. So, the country continues to have sporadic cases. That's likely to continue. But certainly those first 4 months, you did see the outbreak being contained. Most of the cases were imported, about 70%, and the rest of the cases we could define an epidemiological link with those imported cases. So there was no evidence of community transmission. And really what Cambodia did is what WHO has suggested from the start that countries should do, which is test and detect cases. Of those cases, isolate them and provide care, trace the contacts of those cases and quarantine the close contacts and follow them up. And Cambodia has done all of those well. In addition, as I said, Cambodia was able to implement the infection prevention and control in the health facilities so that there weren't any health worker infections. And we know that at the beginning of outbreak, they're often a very important source of further spread. So by doing those basic interventions well, I think that's contributed a lot to the relative success in those first 4 months. These achievements really built on the previous investments in health security, particularly surveillance. We've seen strong government leadership from the very top. The Prime Minister convened a national committee on COVID. There's also an interministerial committee that provides a whole of government approach to addressing COVID. And with our support, the government developed a master plan which sets out the response with 3 different scenarios, and that's been implemented. Cambodia is lucky to have strong partner support, including from us. And whilst the country didn't implement a full lockdown, non-pharmaceutical measures such as border restrictions, movement restrictions, really risk communications, emphasizing hygiene. These were all introduced early. I think also Cambodian culture has played a part. It's not a culture where people shake hands. The country is relatively sparsely populated and relatively young. And finally, I think when we look at the different responses in countries, we don't know everything. There's certainly an element of luck, particularly if you get a cluster that you miss early on. But I think you could only take advantage of the luck if you do put in place the measures that we know are important. And Cambodia in the first 4 months certainly did that. And I think that's contributed a lot to what we saw through to the end of May.
Thank you. Can I ask you a little bit more about the lockdown? Because a lot of other low and middle income countries have pursued quite hard lockdowns, which I understand Cambodia didn't. Although from what you were saying, there were a few things that were closed. But can you tell me more about what the thinking was there? What were the kind of trade-offs and the decision-making process that the Cambodian government was facing?
I mean, we'd say from a WHO point of view that, and the advice we've given is that Cambodia has implemented a risk-based decision-making process, and that really needs to balance the public health impact of interventions with the socio-economic consequences. And I think it's important to keep in mind that Cambodia is a lower middle-income country. It has a very large informal worker sector. And a full lockdown, as we've seen in other countries, would have dramatic consequences for those workers in terms of their ability to earn income and really just to put food on the table. And so I think the government was very cognizant of that. Also to remember that these non-pharmaceutical measures, as again we've seen, are a means and not an end. They buy you time to do the essential public health interventions, to do the test, detect, care, isolate, trace, quarantine. And I think, they're not an end in itself. That said, I'd just like to remind you that Cambodia did put in place a raft of non-pharmaceutical interventions very early. The risk communication started early. Schools were closed after the 9th case. Border measures were introduced in the middle of March. Movement restrictions were put in place for the major holiday in the middle of April. We also saw cancellations of other mass gatherings of the entertainment sector. So I think Cambodia tried to thread that needle and essentially did put enough in place, enough of those measures to limit spread. And most of those measures are still being in place. The challenge going forward is to calibrate and think, okay, how do you, for the economy and for people's sort of social well-being, reduce or relax some of those measures, but then keep a very close eye on what's happening with the situation if you have to reintroduce more of them in the future.
Mm-hmm. If I may, I'd like to ask you a little bit about the World Health Organization's role in all of this, because we hear quite a lot about WHO and headquarters in Geneva, but rather less about what WHO actually does at the country level. So I wondered if you could explain the role that WHO has in helping governments such as the Cambodian government address COVID-19.
So here in Cambodia, we're one of 149 country offices of WHO, and we play a normative coordination and operational role in supporting the country, supporting the government to tackle COVID-19. So we've been involved from the outset, from when we first got the advice from China, supporting the government to prepare at the beginning of the year. We helped them develop the Cambodia Master Plan for COVID-19, and we've helped in its implementation. So I think the familiar role for WHO is that we give technical advice, we provide the advice from headquarters, we adapt it to the country context here in Cambodia. We provide fora to share the experience of other countries. There are regular fora where ministers share experiences, where focal points for communicable diseases share experiences. We also, I think, another familiar role is that we coordinate partners technically in terms of resource mobilization and operationally in terms of procurement. And we've had a very central role here to support the government in doing that. But one role perhaps at country that people are less aware of is how operational we are in emergencies. So here in Cambodia, parts of our team are out contact tracing with the Ministry of Health in the field. We've been at hospitals and health facilities helping to prepare them for COVID. Even when the first cases come in, we've helped to make sure things are going well in terms of infection control. We've helped develop the clinical guidelines. I've been at hospitals myself. We've really helped to support the labs. We're there developing risk comms. We've been in the schools. We've been in workplaces. So I think that operational role is something that people often don't think of WHO as. Of course, our primary role is normative, but particularly in health emergencies at country level, we do have this operational role. And then finally, we're also been involved, given the challenges globally we've seen with this pandemic, in directly procuring supplies and purchasing supplies like personal protective equipment. We've helped to get ventilators in, getting pulse oximeters. When ventilators have arrived, we've been there checking to make sure all the equipment and all the parts are there. So it's a very varied role. And, that's our job. It's our privilege to really be there with the government and the country in every aspect of COVID-19 preparedness and response.
Yeah, I was going to say, it sounds like you have a finger in every pie, as it were, that you're playing roles that encompass not only the kind of normative role of setting guidelines and providing advice, but also some of the hands-on stuff, as well as coordination, which I imagine in a country such as Cambodia with multiple development partners, coordination around an outbreak like this could be a fairly heavy lift.
Yeah, I mean, our job really is to support the government to lead. And as I said, the government here has taken it very seriously. But that coordination role is certainly significant. I mean, for example, we worked with the World Bank to support them in dispersing $34 million of loans very quickly to support the government's response. And they invited us to be part of the negotiations here, and they really relied on us to advise them technically. And I think, that is an important role that I think people appreciate, both government and other partners.
One final question for you, and I think it's a question that will resonate with other countries as well. I mean, Cambodia appears to have done a fine job fighting this first wave of COVID-19, but we all know that there could be future waves of the epidemic. And I think one of the big challenges for countries is sort of how to sustain a focus on fighting COVID when there are so many other demands upon policy and decision makers' time. Do you have any insights from Cambodia about how to sustain that focus?
As you say, this is a major challenge for all countries. And there's two aspects I'd like to highlight. One, as I said, is how do you continue this risk-based decision-making, balancing the public health impacts of your interventions, of implementing the master plan here with the socio-economic consequences of COVID itself, and also of the interventions that you implement, because they are important. And for example, the economic damage that happens with COVID, that has public health impacts as well. And so it's very important to keep those in mind. My sense here is that the other challenge is just maintaining motivation. So I think in a sense, at the beginning of an outbreak, if you manage it well, then your challenge is maintaining motivation, because often people feel like, okay, we've done that hard work, we've made those sacrifices. How do we keep going? And especially with all the uncertainty, there's so much we still don't know about this virus. And one of the things we really don't know is how long this pandemic is going to last. But we know that, we're looking at quite plausibly another year. We know that possibly COVID will never go away. I mean, we hope to have a vaccine. We hope that we will get over this pandemic like others. So maintaining that motivation is very challenging. And so I think what countries need to do is, and I think that is what the government is very much doing, nobody here thinks the job is over. There's likely to continue to be sporadic cases, and the risk of a larger outbreak and community transmission is always there if you miss cases, if you miss a cluster. So it's continuing to put out the messaging. It's really supporting community engagement. It's monitoring the situation and calibrating the measures. When you do relax measures, for example, opening the border slightly because of the economic requirements, really sort of monitoring what happens and being ready to reintroduce stricter interventions if required. And continuing to strengthen the system, both the public health system and the healthcare system, including for non-COVID services. I think that's a real focus. I mean, often people die more from the routine threats than the new infectious disease like COVID because people don't seek care or the services that are disrupted. So there's a lot of focus here on maintaining essential services, a lot of other challenges in this country, and really focusing on sort of marginalized populations, and that increasingly the focus often starts at the center, but in the end, what determines your success is the level of the local government response, the community engagement, and then your ability to mitigate the social and economic impacts so people stay motivated.
Thank you very much, Dr. Rasanathan. I think that it was particularly interesting to hear about WHO's role on the ground in terms of addressing COVID-19, but also the really remarkable achievements that the Cambodian government has made in this regard. So thank you very much for joining me.
Thanks so much, Sarah. It's been a pleasure.
Thank you for listening to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Please send questions to be covered in future podcasts to publichealthquestion@jhu.edu. This podcast is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Lamare Morales. Audio production by Niall Owen McCusker and Spencer Greer, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.